The 2008 Fine Award for Team Excellence. Gold winner, Magee-Womens Hospital of UPMC. Labor Induction Process Improvement.
The problem we were seeing in our Women Care Birth Center was related primarily to efficiencies, timeliness of getting patients into particularly our cesarean section area. And so we knew that we had a lot of inefficiencies that were making patient flow more difficult than it needed to be, which was affecting both patient and staff satisfaction.
Any idea when my induction's getting in?
I am trying to get her in, Dr. Fish, but we are really busy. All the beds in the back are full. Triage is hopping. There's four patients
home for
that need.
3 hours.
I just spoke with her. I just spoke with her.
She called me, and
I just spoke with her, and I
what
told
am
her
I
that
gonna do?
I'm doing the best I can. I'll get her in as soon as I can. I promise. I'll call you. As soon as I call her, I'll call you.
Here at Magee, we've experienced growing volumes over the last several years. About 500 to 600 deliveries every year, increasing, without increasing our facility.
The physicians thought that we simply needed to add more staff. The physicians thought we needed to expand our facilities, which we in management looked at as both short-term options. We were interested more in long-term improvements.
So the walls weren't moving, but our volume was changing, and we had to respond to that.
We saw that it was more important for us to address this entire issue of the scheduled inductions as a long-term solution, because we knew that our volumes were going to continue to grow, and no matter how many staff or how many extra rooms we added, if we continued on the course we were in at that time, we were again doomed for failure every day.
And we talked about our goal being improving patient satisfaction, improving physician and staff satisfaction.
So the staff really bought into this early in the game because they knew it had to improve their basic lot, and they were quite anxious and willing to help us.
So if we look at how many inductions actually occur every day and the average time to delivery, we'll have a better sense of how many slots we need and how to space them apart to try to level that work.
So we were able to convince the physicians that it was entirely inappropriate to do inductions less than 39 weeks of gestation. And interestingly enough, they were doing these prior to us paying particular attention to this. And the reason that was so important on the quality side of the equation was that some of those babies that were then at risk of going into the neonatal intensive care unit. A very traumatic event, obviously, for mother and baby. So we spent a lot of time looking at data. We showed physicians their data. We also were concerned about getting quality right the first time.
Part of the problem previously with scheduling our inductions is that we were asking for a Bishop score, but not necessarily getting that on every patient. Our new process requires a Bishop score, and there's a range within which they have to meet. One of the other pieces that we put into this whole process that was critical was to isolate the actual scheduling process to a key person.
Okay, thanks, Dr. Fish. Bye-bye.
Previously, we had whoever was the charge nurse for the day who has multiple responsibilities, receiving phone calls to schedule the induction.
Can you hold on 1 second? I'll grab the phone. Prenatal monitoring, Gina.
And to receive phone calls from patients asking is it time to come in. Perfecting patient care teaches us to approach this problem by looking at standardized processes so that there's not deviation from one person to the next in different situations. We now have someone whose sole responsibility it is to schedule our patients for both inductions and our C-sections.
One of the process changes that we put in place related to this is we use a pull system where we actually call the patients and have them come in for their induction rather than just showing up.
It's fine for you to go ahead and come on in right now.
We were seeing approximately 9% of our deliveries were elective inductions. We're now down around between 3 and 6%. More importantly, what we've seen is a decrease in our cesarean section rate. We were averaging in the mid-20s on first-time mothers were now down around 14%. We had about 12% of our babies were being induced before 39 weeks gestation. We were now down under 3%, and in the month of September we actually had 0 that were induced less than 39 weeks. Those are the patient safety items, in addition to the improved quality, patient satisfaction, staff satisfaction, all very important components of this program.